There are several implications regarding RN shortages in the U.S. These RN shortages have the potential to impact the quality of healthcare by understaffing, which increases risk to patients and acts as a barrier to accessing healthcare. And then also, it has an issue with cost as well. In 2023, the U.S. ranked 69th out of 167 countries in healthcare system quality. As registered nurse shortages and turnover persisted since 2018, the ranking has similarly fallen. As far as cost is concerned, the U.S. is already notorious for having the highest GDP percentage spent on healthcare. The RN shortage and turnover add significantly to this issue. The average cost to a hospital for RN turnover has grown each year since 2020, outpacing inflation. For every nurse attrited, a hospital can expect to pay around $55,000. For a small hospital with just 30 nurses, this means they can project to see an expense of over $300,000 annually. U.S. It's a commonly talked about subject, but rarely do we hear anything other than analogous proof of the issue. So here's some evidence that really drives home how cascading this issue is. So some evidence of the issue is that when surveyed, 83% of healthcare executives assessed they would have staffing shortages of RNs in the next year. This is over a 50 percentage points higher than the assessed understaffing of physicians. Further exacerbating these shortages is the turnover rate of RNs. Since 2018, RN turnover rates have climbed and are projected to continue to rise by nearly 1 percentage point annually. There are three primary drivers of the RN shortage in the United States. Number one, engagement. On a scale of 1 to 3, with 1 being completely disengaged, 2 being underengaged, and 3 being adequately engaged, nurses scored a 2.4 nationally, with 60% of the respondents feeling underengaged. Number 2 is the gender demographic. Only 12% of RNs are male, which leaves a large opportunity for recruiting and retention of male nurses and represents an underutilized demographic for potential staffing increases. Number 3, the age demographic. 20% of nurses in the United States are either over the retirement age or within 5 years of retirement. While recruitment of young RNs has been successful, retaining registered nurses in their 40s and 50s is critical to both retaining experience and keeping adequate staffing levels. There are certainly some course concepts that can help us address this issue. Number 1, how organizational cultures are structured within hospitals in the United States, and how are they assessing the impact on RNs? Number 2, how are we leveraging DEI, and how do systems that support DEI function in recruiting, promotion, and retention of registered nurses? And number 3, how are our leaders motivating our RNs? Are we looking at Maslow's hierarchy of needs and really assessing them? Are we looking at how we're forming teams, utilizing? We'll explore these concepts further.
Some general steps to solve the problem can include recruitment strategies by implementing hiring protocols to minimize delay, partner with nursing school and address barriers, engage in ethical international practice, provide relocation support. As a retention effort, we can use competitive compensation, including benefits, offer leadership training programs to career development. We can also introduce loan repayment program for continuing education. Culture and engagement are very helpful. Developing initiatives to celebrate for high-performing nurses will be nice. Conducting regular team-building activities such as workshop and retreat can be also implemented. Lastly, creating open communication channels for feedback and concern will allow. We can implement mental health support programs, including counseling services. We can also use technology to reduce the administrative workload, such as the automated scheduling, and we can also implement workforce planning. Some change we can implement can include creating a safe environment by establishing zero-tolerance policies for harassment and bullying, modernizing facilities, and provide ergonomic equipment to reduce physical strain. We can also improve workplace flexibility by introducing scheduling options and remote roles. We can include a loud, condensed work week. The expansion of career development opportunities will be very helpful by developing pathways for promotion, providing funding for continued education. The offering of compensation and benefit will provide sign-on and retention bonuses and improve benefits such as leave, child care support, and stipends. We can also promote employee recognition and wellness by dedicating resources such as stress management and a workshop. Challenges and barriers. Safe and respectful work environment. Employees may be resistant to new initiatives due to the cultural shifts. Introducing a safety culture will be challenging initially, requiring effective training, communication, and consistent enforcement. Time, cost, and facility utilization. Modernizing outdated infrastructures are costly and time-consuming. This can delay upgrades and it can divert funds from other programs, impacting revenue, staffing, and even patient care. Operating 24 hours and having flexibility with hands-on patient care means that most of the clinical roles cannot be performed remotely, and flexibility in the work arrangements is limited due to the nature of the services. Increased burnout. Condensing work weeks means longer daily hours, increasing the risk of fatigue and critical errors, further exacerbating burnout. Career development opportunities. Hospitals, hierarchies, and silos can limit advancement opportunities. Staffing shortages and high-stress conditions could hinder the ability to train employees. Career development represents a significant financial investment, but while it's beneficial in the long term, this return is not intangible, can be difficult to measure, and can be slow to materialize. Compensation and benefit strains such as higher wages can strain budgets, especially in public institutions. Non-monetary benefits like childcare or transportation can add further operational burdens. A challenge for employee recognition and wellness programs. We need managerial support and consistent execution. In higher stress environments, inconsistent administration can create division sometimes rather than unity. A barrier for this will be the wellness program demand time and money, and may not attract universal participation due to the workloads and schedules. Addressing the workplace efficiencies can directly be done rather than having to rely.
Hello everyone. Now that we have discussed the solutions, let's explore the potential risks and costs associated with implementing these recommendations. First, recruitment challenges include cultural barriers and regulatory complexities, particularly when hiring internationally. Accelerated hiring processes, while addressing immediate needs, risk overlooking long-term capability, which could lead to higher turnover rates. Second, there are retention risks. Adjustment to compensation or benefits can create perceived inequities among staff, especially if they feel excluded from these improvements. Additionally, inconsistent leadership training could undermine efforts to improve engagement and retention. Third, we have cultural risks. Initiatives like open communication channels and recognition programs may unintentionally highlight workplace tensions or create biases if not carefully managed. Now, let's move on to costs. Financially, the cost of turnover for a single registered nurse is approximately $56,300, which highlights the high stakes of workforce retention. Additional investments in DEI initiatives, leadership training, and facility upgrades place further strain on budgets. Operationally, disruptions may arise during the transition to flexible scheduling or workload redistribution, which requires significant planning and adjustment. These risks and costs underscore the importance of thoughtful implementation. Beyond risks and costs, we must also consider unintended consequences that could arise. First, there is the risk of burnout redistribution. Reducing nurse-to-patient ratios might unintentionally increase workloads for auxiliary staff, such as administrative or technical teams, shifting stress rather than alleviating it. Second, cultural misalignments could occur. DEI initiatives focusing solely on recruitment metrics with fostering inclusion may result in tokenism, leaving employees feeling unsupported. Third, recruitment without addressing systemic issues could lead to short-term turnover spikes, as new hires might face the same unresolved challenges that caused prior staff to leave. To address these challenges, we propose mitigation strategies. Comprehensive onboarding programs that include mentorship and cultural sensitivity training to ensure seamless integration for new hires. Transparent policies that equitably communicate compensation and recognition initiatives to build trust and cohesion. data-driven monitoring, or key metrics such as employee satisfaction and turnover rates to continuously refine programs. Lastly, fostering inclusive DEI practices that go beyond diversity metrics to build a genuinely supportive workplace culture. These strategies aim to ensure that our solutions are both impactful and sustainable.
After conducting our research, we firmly believe that the various recommendations we have would be highly beneficial to alleviate national nursing shortages. However, communicating these recommendations with a client or target audience is an equally critical step to consider, especially in relation to responding to potential resistance. We would like to emphasize the quality of information and notable successes that have occurred in the past with similar change initiatives. Firstly, embracing diversity is essential for any team. A manager, for example, could conduct team surveys or meet personnel one-on-one to assess evidence of discrimination. This manager could also acknowledge the inherent value of diversity, which can foster innovation and unique perspectives. Secondly, there are various examples of past legislation-based programs which have increased access and funding for continuing educational opportunities. This has expanded the qualifications and roles of nursing staffs. Finally, nurses need support services in such a stressful work environment. Although some surveyed nurses have indicated a lack of time to dedicate to such programs, mental health and stress management programs have both had a notable benefit. We implore that these recommended changes be analyzed and considered for further implementation. Thank you very much for listening to our presentation.